Within the world of oncology, breast cancer is perhaps one of the best known. Some of the factors that may increase the incidence of this type of cancer are risk factors such as obesity or physical inactivity, changes in the reproductive patterns, or the aging of the population, a consequence of the welfare society. Breast cancer remains the leading cause of death among women in developing countries, although the incidence varies significantly by ethnicity. Breast cancer is not a disease exclusive to the female sex. It can also occur in men of any age, although it is more common in older men. In any case, the incidence is much lower than in women. Its prevalence is less than 5%. As a basic concept, whenever we talk about cancer, we should speak about oncogenes. An oncogene is an abnormal or activated gene which comes from the mutation of an allele of a normal gene called a proto-oncogene. Oncogenes are responsible for transforming a normal cell into a malignant cell that will develop a specific type of cancer. One of the essential oncogenes is HER2, associated with breast cancer. Precisely for this reason, its progression is studied and analyzed in terms of both survival and potential recurrence. There are different types of breast cancer depending on the absence or presence of estrogen or progesterone receptors. Hormone receptor positive ERBB2 negative, ERBB2 positive, or triple negative when tumors lack all three standard molecular markers. Looking back, a positive fact is that the mortality rate has been steadily decreasing for the last 30 years. In addition, it has also been proven that many breast cancers are non-metastatic at the time of diagnosis. In any case, it is essential to identify and understand in depth the patterns of each type of cancer. This way, clinical strategies will be able to have an increasingly personalized approach to establish more and more effective treatments. In terms of treatments, apart from cyclophosphamides, according to recent research, we find trastuzumab, which as an adjunct to chemotherapy is offering good survival results. However, the analysis of gene expression in breast cancer has not made it possible to establish individually tailored therapeutic strategies. In genetics, breast cancer cannot be understood without talking about genomic instability, which is the increased tendency to present DNA mutations or other genetic changes that appear during cell division and are usually associated with many types of cancer. Among the most critical genetic tools we've found, two are particularly noteworthy: microRNAs, which are diagnostic biomarkers, and genetic tests that can be preventive when they analyze part of the genes involved in pathology, or diagnostic when they analyze all the DNA that affects that pathology. Our health test includes the genes CHEK2, CDH1, and ATM, directly related to breast cancer. 24 genetics tests as preventive allow making more informed decisions, helping people to improve their well-being. Knowing your genes is taking care of your health.